for listening to Confidence Equals Beauty with Amanda Taylor podcast. I'm your host, Amanda Taylor. I am a trained mental health therapist with years of experience working with people of all ages. I am passionate about helping others find their own inner confidence and overcoming negative stigmas. I have spent my entire life trying to help others in their times of need, but I was struggling to overcome my own insecurities, trying to show up how I thought others wanted me to be. It was not until I finally reached inside myself and gained my own confidence I was really going to find my true passion and purpose and wanting to help others do the same. I want to help you discover how beautiful and wonderful you are using my own life experiences and tips. Here we will talk about all topics that can help you find your own true confidence, because confidence equals beauty. Hi guys, and welcome to Confidence Equals Beauty podcast, and I am Amanda Taylor, and today's recording is just going to be a little different. This week has been one of those weeks that I just haven't had a moment to stop and breathe, because it's going from one activity to the next. My children are involved in multiple activities, and on top of that, I volunteer with various organizations. So this week, I am actually doing the recording in my car, waiting on one of my children to finish up dance. So you may hear children running past. You might hear horns from cars. I'm not really sure what you might hear in the background, but I do apologize. But this is really the only time I had to even do a recording, is sitting in my car waiting on my children to finish what they're doing. So I just want to say I'm thankful that you're listening today. And in season 2, I'm going to be going through a series of different mental health diagnoses, where I'm going to provide education on different common mental health disorders. And this is to help bring more awareness to mental health. And many times people have no idea that they are experiencing mental health symptoms until sometimes it's too late. Or often they will ignore it, avoid it, and not even acknowledge that something may be going on. I personally believe that knowledge can create power and freedom from mental health concerns. And as we go through this episode, I want to be very clear that this is for educational purposes and not to diagnose anyone, just to bring awareness to you. So in the topic today, we are going to be discussing depression. And depression is a serious mental health condition that goes beyond normal feelings of sadness or temporary mood changes. It can affect various aspects of a person's life, including emotions, thoughts, and behaviors. And some common symptoms of depression, and this is according to the Diagnostic Statistic Manual of Mental Disorders, version 5 text revision, also known as the DSM-5-TR. And this is the manual that I used in graduate school throughout my career as a mental health therapist. And this is how I go to and properly diagnose someone. The manual tells you, it's a very, very thick book, and it will tell you codes. It tells you if you're billing for insurances, it gives you the code to use. It gives you the diagnosis. It also gives you symptoms of everything that you're looking for. So as a client would talk to me, I would start noticing the symptoms. And I would take either a mental note, or I'd jot down symptoms, or they would write down their symptoms. And then I would have it compared to the DSM. And that's how I would diagnose someone. And it's used with mental health, used with psychiatrists, psychologists, anything when you're dealing with mental disorders. So according to the DSM-5-TR, depression symptoms include persistent sadness, feeling sad, empty, or hopeless for an extended period of time. And usually how we would rate this would be 3 to 6 months or more persistent going on. Loss of interest or pleasure, and losing activities that were once enjoyable, like such as sports, hobbies, even in relationships that we found enjoyable, now it's not. Another symptom is angry outburst, irritability, or frustration, even over small matters. Changes in sleep patterns, insomnia or oversleeping, fatigue, feeling tired and lacking energy even after rest, difficulty concentrating, trouble focusing, making decisions, or remembering things, anxiety, agitation, or restlessness, appetite changes, significant loss or gain to changes in eating habits, feelings of worthlessness or guilt, experiencing excessive or inappropriate guilt and self-blame. Physical symptoms can include aches, pains, headaches, or digestive issues without clear physical cause, frequent recurrent thoughts of death, suicidal thoughts or suicide attempts or suicide. Now, as I went through this list, please note that it's important that depression can vary in severity, and not everyone with depression will experience all of these symptoms. So as a therapist, I would sit there and I'm going to listen, and I'm going to, if the majority of the symptoms are matching depression, that's how I would diagnose someone with depression. Not just because, oh, I feel sad, or, oh, I lost my appetite. We're going to dive in and look at more. So if someone is experiencing symptoms of depression, it is crucial to seek professional help. Treatment options may include psychotherapy. This would be seeing a therapist, counselor, a psychologist, or a psychiatrist. Medication, lifestyle changes, and support from friends and family. And depression is a treatable condition. And with the right interventions, many individuals can experience significant improvements in their symptoms. And that is why I encourage professional help. And as a therapist, I have sat in the office with many, many clients throughout the years. And I saw significant changes from when they started therapy. And each person's different. So each person would go through their therapy, and some would be done in a couple months, some took years. But it was good and rewarding to see when people would come to see me as a therapist. It was amazing to see they put the work in, we worked together, and they were able to work through their depression. I think it's important for individuals and those around them to recognize that depression is not a sign of weakness. And it's not something that can be overcome by sheer willpower or just snapping out of it. And depression is a complex mental health disorder that often involves a combination of biological, psychological, and emotional factors. And the acknowledgement that depression may require long-term treatment is also significant. Recovery from depression is a gradual process, and finding the right treatment approach may take time. So let me give you an example of this. Client would come into my office, we're working in one direction, and we realize this technique is not working. We would then change goals, we would change the technique, and then we would revamp what we needed to in order to meet the client's needs. And there have also been times where I had a client and the rapport was not there, and it was really appropriate for me to refer them to someone else. So I think when you keep that in mind, that it takes time, it can take different angles, I think that's when people can feel a little bit more relief that it's not just, okay, they're untreatable. No, it just takes time. And so there's also lifestyle changes to be recommended for managing depression effectively. And this really, once again, I encourage therapy. Seek professional help, because this is where you can process what you're going through, and the professionals can help you figure out what you need to adapt and change. So you can, if you're looking like, how do I actually do this? You can actually start with your primary care physician. If you have access to a psychiatrist or a psychologist or any other mental health professionals, they can provide proper diagnosis and develop a personalized treatment plan for you. So I want to break this down a little more. I talked about the areas of, biology. And this actually can mean that your depression could be a chemical imbalance inside of you. And most people do not realize that, like a medical condition, where medication is part of treatment, physical symptoms of a medical condition. Mental health can also have symptoms that can be treated with medication to help create a more balanced and healthier way to manage symptoms. And often I have heard negative stigmas on taking medications, for example, taking an antidepressant. And so this is what I encourage people. This is what I'm going to say to you. I would say to those concerned on how it looks, quote unquote, to be taking an antidepressant, I would tell them you would not think twice if you were diagnosed with diabetes and needed insulin to help regulate your sugar levels and keep you feeling better, and everything else that would require to take care of diabetes. You wouldn't think twice about it. You would do it. Then I'm going to encourage you not to think a medication such as an antidepressant is any different. And you would seek out a psychiatrist to be the best at prescribing the better medications, because that is what their specialty is in. Yes, general doctors can prescribe medications, but a psychiatrist is more specialized, and they're the ones that can actually really create a better medication regimen for you. Psychotherapy. This is a series of going to a mental health professional and allowing yourself to go through therapy to help learn techniques and ways to manage depression symptoms. And this also ties together with recognizing potential lifestyle changes that can help better manage depression symptoms. I have sat with clients throughout my career, and we would go over different therapeutic techniques and often include lifestyle changes. And it was amazing to see the significant improvement in their depression symptoms by just changing some things in their life. Support from friends and family is extremely important. Understanding compassion from loved ones can make a significant difference in the recovery process. And creating a supportive environment and encouraging individuals with depression to seek help are essential steps in managing the condition. So if you're in a situation where everyone's like, nah, it's not depression, whatever, and you just don't feel supported, I would encourage you start looking outside for those who do support this, who are understanding, who will bring you comfort, who will be with you along your journey. And you don't have to explain it to anybody. You don't have to convince anybody. And that's the key thing I want to tell you. If you're feeling like, okay, yeah, I'm resonating with these symptoms, I think this may be something I'm going through. You don't have to convince someone you're going through this. Find the people who will support you. So the good news is depression is a treatable condition, and many people do find relief with the right combination of treatment and support. And it's important to break down the stigma associated with mental health issues and promote a better understanding of depression, as I would say more like, even though it is mental health, I would kind of think of it as a medical condition that requires appropriate care and attention. You wouldn't let your arm bleed out until you died. You would bandage it up. You would get stitches. You would do whatever you needed if your arm got cut. Same thing. If you're having depression, don't ignore it. Get the help you need. So I hope this helps you have a better understanding of depression and how depression can be treated. And next time in this part of Mental Health Awareness series, I'm going to go into more details about different recommended treatment options that can help reduce depression symptoms. And I want to add in the show notes, I have provided information for crisis hotlines. If you do find yourself in immediate care, you do have suicidal thoughts, you're thinking about it, this information, these crisis hotlines are there for you to call and get the proper help you need immediately. So the information provided can better move you towards treating your depression symptoms and point you in the right direction. And once again, thank you for hanging out with me. And remember, confidence equals beauty. Hi, and welcome to Confidence Equals Beauty with Amanda Taylor. I am your host, Amanda Taylor.